Good afternoon, everyone, and thank you so much for joining us. I'm Sarah Rosen Wartell, with the great privilege of being the president of the Urban Institute and welcoming you. First, a few housekeeping rules. Today's event is being recorded, and the recording and relevant links will be posted online after the event. All participants are automatically muted, but we have closed caption turns on, and if you'd like to adjust your settings, you can click the live transcription button at the bottom if it's distracting to you. Type your questions or comments into the questions box at any time. We don't have much time, but I'll try to weave in what I can. And even if we don't answer them all, it's helpful to us and the panelists to know what you're thinking about to shape what we're doing in the future. And of course, I encourage you to please join the online conversation on Twitter. Use the hashtag #live@urban. Today's event is part of a series of discussions we're holding with leading changemakers and policy analysts on questions emerging from the COVID-19 crisis and the long overdue reckoning with our nation's ongoing structural racism. For decades, immigrants to the United States who face hardship have encountered a safety net that can be so very difficult to navigate, with eligibility and access varying by the official status of immigrants and their families, by rules of specific programs, language barriers, and fears about the effects of participation on their prospects for a visa, green card, or naturalization. Since 1982, our immigration laws have included the concept of public charge. In deciding whether to grant some applicants a green card or visa, an officer must decide whether the person is likely to become dependent on certain government benefits in the future, which could make them a public charge. However, the circumstances were relatively narrowly construed. The Trump administration first proposed and then sought to implement in 2019 a final revised public charge rule, which expanded the circumstances in which applicants might be denied admission to and residency in the United States. Long before the rule was in place, many immigrants became far more fearful about receiving any public benefits that might help them and their children and families to thrive, even those for which they were clearly qualified, for fear of immigration consequences. While litigation ensued and confusion reigned, the pandemic hit, hitting especially hard many Latinx, Asian, and other immigrant communities. Yet these populations were further disconnected from a U.S. safety net than they have ever been before. And the initial relief packages further excluded immigrants from receiving stimulus funds. The Biden administration recently withdrew the appeal of a court decision that had struck down the public charge rule, so it is effectively no longer in effect. The Trump-era public charge rule is no more. And the two most recent pandemic relief bills have expanded eligibility for some aid, including more opportunities for immigrants to receive some forms of financial support. And yet, immigrant families continue to face many barriers, both formal and informal, in accessing the safety net. Confusion still reigns from the earlier era, and all of the complications that existed before remain. These barriers, in many cases, decrease both the well-being of families and the economic success and health of their communities. So to discuss this challenge, we have two-part conversation. In the first part, I'm very pleased to be joined by Representative Judy Chu, who represents California's 27th district in the LA area and has been organizing colleagues in Congress in an effort to include immigrants in COVID-19 relief and to oppose the Trump-era public charge rule. After that, I'll chat also with two other experts to talk more about these rules and regulations. So thank you, Congresswoman, for joining us today. I hope you are well. Great. Nice to see you. Welcome. Before we turn to today's topic, I do want to take a moment to express on behalf of the Urban Institute community our support for all of those who are facing the rising waves of anti-AAPI hate and violence, and especially to those who are affected by the sadness triggered by the recent events in Atlanta. We stand strongly with you and your constituents. So thank you for being here. Representative Chu, nearly 40% of your LA area district is foreign born. How has the pandemic affected the immigrant residents of your community and their family members?
Well, first, let me say thank you, Urban Institute, because you have laid the groundwork for us to fight the anti-immigrant federal policies that have been put on us in the last 4 years. With your data, with your research. And believe me, it's a powerful tool that I have relied on time and time again when I am speaking to people on Capitol Hill, when I'm at the hearings. So it's incredible what you are able to do. Well, this pandemic, of course, has exposed deep inequalities in our healthcare system. Each of us are equally susceptible to the virus, but not all of us are equally impacted by it. Communities of color, and especially immigrant communities, have had some of the worst experiences battling this pandemic. For instance, most frontline workers, whether nurses, teachers, or supermarket workers, tend to come from immigrant communities, which means that they're putting themselves at risk for our sake. And yet, these communities have less access to quality health care, which is why you are seeing higher infection and mortality rates in Black, Latinx, and Native Hawaiian and Pacific Islander populations. And in fact, it is your research that documented that anti-immigrant federal policies, such as the public charge rule, have deterred immigrant families from seeking health care, food, and economic assistance, even as the pandemic's health and economic burden has fallen most heavily on them. That's why I worked so hard when we were developing the American Rescue Plan to ensure that we blocked any efforts to restrict coverage of testing, treatment, or vaccinations against COVID-19 in ways that would have left the immigrant communities behind. We simply can't afford to leave an entire population out of our relief efforts, which is what Republicans, unfortunately, were trying to do over and over again. Nonetheless, we still have work to do. For instance, I tried to get those who are the ITIN recipients to be able to get the economic relief checks, but we were unable to do that. So clearly, there is so much more relief that we need for our immigrant communities. But I must tell you, these problems extend to the business community as well, which is why we debated relief legislation over the past year. And when we did that, I pushed for the Small Business Administration to translate their materials into other languages so that non-English speaking business owners had a chance at this economic relief. These businesses were hit just as hard by the pandemic as their English speaking neighbors. They certainly are deserving of just as much relief. And I do have to tell you that at the beginning, there was a huge problem where the big banks were the ones who gave most of the loans, the big loans, to their ongoing loan customers. And so it shut out the small, truly small business who didn't know how to get through. So we did a $60 billion set aside to make sure that it was the community banks and the community development corporations that really serve the underserved communities that would be able to get the funds to get those PPP loans out to the immigrant communities that we intended it for.
Well, you touched on a whole bunch of things that I want to come back and poke on, but I wanted to start with a question about day one of the new administration. When President Biden issued what was a very powerful executive order that directs every federal agency to take into consideration the implications of policy choices on equity gaps, sort of weighing whether a new rule or a new piece of legislation would widen or close gaps in access to opportunity, in wealth, in access to loan programs, whatever the issue may be, for particular populations. The executive order focuses particularly on race and ethnicity and other aspects of identity, but it doesn't speak to immigration status. And I'm curious your reactions to that choice.
Well, there's so much overlap, though, between underserved communities and immigrant communities. So even though he did not specify immigrant communities, I think they'll absolutely benefit from this order. That's why I work so hard to push for SBA and other aid to target underserved communities as well, and push so hard to make sure that they translated the materials into other languages so that non-English speakers can benefit. And that's why in this latest, the American Rescue Plan, we actually have a set aside for community navigators who would actually help the smallest of businesses to be able to figure out how to go through the bureaucratic system that would get them the loan, the forgivable loan, in fact, that they need. Now, I'll give you an example from the AAPI community. Even before the pandemic, AAPIs had a hard time accessing care due to language and geographic barriers. And we didn't even understand how much that was happening because there was a lack of disaggregated data that limited our understanding of the needs of our diverse AAPI communities. Whereas we do know that certain of our subsets of communities, like the Native Hawaiian Pacific Islanders, are suffering so much more. Now, a year into the pandemic, these inequalities for APIs are only getting worse, and other factors are keeping us from responding appropriately. 1/3 of AAPIs are limited English proficient, but vital information about the pandemic is still not readily available in all the AAPI languages. And these trends are especially distressing because of the disparate impact that COVID-19 has had on the AAPI community, as well as other communities of color. But for us, in the first year of the pandemic, there was a 35% increase in the mortality rate of Asian Americans compared to the average of the 5 previous years. And in fact, from December to January, there was a 2-fold increase in deaths for Asian Americans. We know that other immigrant communities are similarly suffering. In addition to translating more materials for non-English speakers and doing more to target aid to these neighborhoods, there's also more that we must do directly for immigrants. Like I said, the survival checks were not sent to undocumented workers that used I-10 numbers for filing. And that is so unfair since these workers pay taxes and are a part of our community. They deserve to have the same help as everyone else. At least we were able to make sure that in the American Rescue Plan that we passed last month, that mixed status families could be included and that those with Social Security numbers would be able to get the checks they so deserved, whereas in previous iterations, they were not able to.
So Congressman, as you know well, probably better than most, so many of the different programs each have their own eligibility criteria. Are there programs where, even with the passage of the recent law, you would like to see further work being done on eligibility to help expand access for the immigrant populations? And if so, what are the sort of priority areas that you're thinking about?
Well, I feel that there is a lot of work that has to be done. And that's why I introduced the Coronavirus Immigrant Families Protection Act early on in the program in the course of the COVID-19, which ensures that any benefit received during the pandemic doesn't count as a negative factor in future immigrant status determinations and prohibits discrimination based on immigration status in any program that is funded by the Coronavirus Relief Bill. And it makes emergency Medicaid services available to all immigrants, and the Disaster SNAP program would be extended to allow individuals and families impacted by the pandemic to receive individual assistance from FEMA. Of course, it would address the I-10 problem, the individual tax identification number, so that they can get the checks that they deserve, and would also make sure there's translation. Federal agencies would be able to translate the relief efforts into the most frequently encountered languages, and also have community-based organizations have culturally and linguistically appropriate materials for screening, testing, and treatment. And finally, it would modify immigration policies that would deter immigrants from seeking health services for the duration of the COVID-19 emergency by suspending in-person ICE checks, and make sure that they feel safe. So I feel that yes, our efforts need to be updated, and that they need to be more sensitive to immigrants. I also believe that we can do so much more in terms of the underlying system of our safety net. And that's why I support Congressmember Jayapal's Heal for Immigrant Families Act, which would remove unnecessary barriers to healthcare access for immigrant families. It would provide access to public and affordable health coverage for DACA recipients, provide access to Medicaid or the Children's Health Insurance Program to lawfully present immigrants without that 5-year waiting period, and allow undocumented immigrants to purchase health insurance through the Affordable Care Act marketplace, and so that they could get the health care they need. I mean, this safety net has to be there for on an ongoing basis for all immigrants.
So I want to close with this question. The last couple of years, even before the pandemic, was a period in which there was a great deal of anxiety and confusion across the immigrant communities about immigration enforcement and how the public charge rule might affect many people and their families. The change in the fact that the rule is no longer in effect doesn't necessarily remedy overnight the challenge of confusion. And how and what can we be doing as a country to try to provide more information, more clarity to people, and try to overcome some of the barriers to participation in programs that people are completely eligible to participate in that may be harming their ability to support their families and sort of become resilient to make a better future?
Well, the public charge rule has caused so much confusion across the United States. And I had nonprofits that serve the community that saw an immediate drop in those who normally would use their services because people were so afraid of the consequences. Well, you know what? It had its intended effect by the Trump administration. It was an intentionally cruel rule meant to punish immigrants who took advantage of services that they were legally entitled to, like healthcare. I mean, so many immigrants went without seeing a doctor because they were afraid that it would impact their immigration status. And this is especially cruel since it was during the pandemic, when it was more important than ever that we have access to healthcare, especially since many of these workers were in frontline jobs. Anyway, that is why I'm so thankful that President Biden directed agencies to review the public charge rule and rescinded the memorandum, and that it is no longer in effect. But I would say there's still confusion. I don't know if immigrants really know that it's not in effect. Probably not. Still, that's not enough. That's why the American Rescue Plan includes something that I'm very proud of as having pushed, which is $1 billion for a pandemic emergency assistance fund to enable states, tribes, and territories to help families with the lowest of low incomes to cover their additional pandemic-driven expenses and avert eviction and other real hardships. We were able to successfully push back against efforts that would have restricted these funds and made it more difficult for immigrant families to adjust their status as legal permanent residents or US citizens if they use these emergency assistance funds to pay rent or buy food or cover their basic necessities. This was important because excluding immigrants from COVID relief benefits is, of course, incredibly detrimental, but this pandemic emergency assistance funds allows those that are administering it to be able to provide those services regardless of background.
Well, thank you very much for coming and sharing these thoughts with us. Our thoughts are with you and your constituents and the AAPI community around the country. We're enormously grateful to you and for your partnership and working on these issues. Thanks so much for being here.
Thank you so much.
Take care. And now I'm going to be joined by Hamutal Bernstein, who is a Principal Research Associate at the Urban Institute, and Huma Zarif, who's a former staff attorney for the Northwest Health Law Associates, and she has been working to help expand access to immigrant communities to healthcare benefits. So to both Hamutal and Huma, thank you so much for being with us. So Hamutal, I'm going to ask you to step back and just lay a little bit more of the groundwork about, we heard Representative Chu talk about expanded public charge rule and the limitations of pandemic relief for immigrants. Can you just explain to us what were the rules for immigrant access to the safety net before the Trump final rule on public charge? How did they change and where do they stand now?
Sure, no problem. That is a tough question to start off on because it's really complex to
in 2 minutes or less.
I know. So it's hard because there's variation across states and there's variation across immigration statuses, but I can share sort of some basics on the eligibility for the major programs like Medicaid, CHIP, SNAP, and TANF. So in general, undocumented immigrants are not eligible for federal benefits. There are some exceptions for things like emergency Medicaid, immunization, school meals, and a few other emergency supports. Many immigrants with lawful status are also not eligible for federal benefits. So temporary immigrants, they're not eligible. In general, as Representative Chu mentioned, immigrants with a green card, permanent residents, they're not eligible for federal benefits for the first 5 years with that status. That's what she called the 5-year bar. Refugees, asylees, and a few other exception groups are not subject to the 5-year bar. A lot of complexity there. There's also a lot of differences at the state level. Since the 1996 immigration and welfare reforms led to what's commonly referred to as a patchwork of policies. Some states filled in the gaps for portions of the non-qualified groups. For example, many states eliminated the 5-year bar for pregnant women and children for Medicaid and CHIP. I just want to point out these groups who are not eligible for federal programs may be eligible for state or local programs, of course, pending other eligibility criteria. And some states have really led the way on expanding access. And I think we'll talk more about that. So all these basics on paper, they didn't change during the Trump administration, but a combination of immigration and enforcement policies, including an expansion of the public charge rule, really led to a trend of growing chilling effects where we know immigrant families grew even more reluctant to participate in these programs. So the changes to the public charge rule that were proposed and put in place in the previous administration, they did not change immigrant eligibility rules for these programs. It attached immigration consequences to this participation for non-cash programs like Medicaid or food stamps or housing assistance. So that's it. That's the basics in brief. Hopefully that answers.
That's great. And again, the rule, it is not that the public charge rule is gone. It is that we are back to the pre-Trump era public charge rule in which those programs in which participation was thought to make you likely to become a public charge is much more narrowly construed, but there are still consequences from participation in some of those programs, which also gives rise to confusion, if I think I understand that correctly. So Huma, that is a great transition for you. Why was it so hard for people to access benefits even before the expanded public charge rule? Can you talk us through a sort of typical experience of an immigrant family that might be seeking health care, and how do these experiences vary across the different legal statuses that immigrants and their families might have?
Sure. Thank you for having me today. I appreciate all the work Urban Institute is doing. So there are multiple factors that make it challenging for immigrants to access needed supports. First, as Hamutal was talking about, there are eligibility restrictions for certain programs based on immigration status. So that really means your immigration status impacts the services and supports you can access and determines whether you can actually access those food, housing, healthcare, financial supports that you need, particularly now, as Representative Chu was talking about during the COVID pandemic. So if you're a citizen or have temporary protected status, are undocumented, or have permanent resident status, and then whether or not you've met that 5-year bar as a permanent resident impacts what type of public benefits you're eligible for. Then there are other considerations, such as whether folks are aware that the programs exist, whether they know that they are eligible for those, based on income, resources, as well as the immigration status eligibility criteria. And then other things like whether the application process is welcoming, is it understandable and available in the language accessible to the community. So these immigration status eligibility restrictions play out in the health coverage context. So as I mentioned, your immigration status determines what health coverage programs you may be eligible for. And compared to the insured population, those who are uninsured are less likely to have a regular doctor or get timely and routine care, and are more likely to be hospitalized for preventable conditions. So just to give some context, among the non-elderly population, 23% of lawfully present immigrants and 45% of undocumented immigrants were uninsured in 2018, compared to just 9% of citizens. And among citizen children, those with at least one non-citizen parent are more likely to be uninsured compared to those with both parents being citizens. So these rates of
I'm sorry, go ahead.
Sure. And these rates of uninsurance among immigrants make sense when you consider those eligibility restrictions tied to the different health coverage programs based on immigration status. So US citizens, including naturalized citizens, are eligible for all publicly funded health coverage programs, which includes Medicaid, the Children's Health Insurance Program, the Affordable Care Act qualified health plans, and Medicare, if they meet the other eligibility criteria. For people with lawful permanent resident status, as we just discussed, if they met the 5-year bar, they could be eligible for Medicaid or Medicare if they meet the rest of the eligibility criteria. And if they haven't met the 5-year bar, then they could be eligible to purchase qualified health plans on the exchange. There are other lawfully present immigration categories, many of which are also eligible to purchase plans on the exchange. The thing to note is that affordability remains a barrier to accessing health care services. So many people who have access to qualified health plans still have to pay out-of-pocket costs. And so unlike Medicaid, which in most circumstances there are no out-of-pocket costs, qualified health plans do include out-of-pocket costs, and that serves as a barrier for lower income folks to accessing the services that they need. And there is data that shows that even out-of-pocket costs as little as $1 to $3 prevents people from accessing the services that they need, including things like prescription medication. Then there are undocumented folks who really have the least available to them. So they are not eligible for Medicaid, qualified health plans, or Medicare. There are limited scope programs such as emergency Medicaid. Hamutal mentioned that, which covers the cost of emergency room care and inpatient hospital services. And then folks who haven't met the 5-year bar are also eligible for this emergency Medicaid. And then states have flexibility in how the emergency Medicaid program is implemented. So specific service coverage varies from state to state. There's also the Emergency Medical Treatment and Labor Act that requires anyone who goes to an emergency department to be stabilized and treated without regard to their insurance status or ability to pay. But EMTALA was enacted in 1986, and it's been an unfunded mandate. And so then there's these charity care mandates, both federal and state, that help meet some of this need, but it really varies from state to state and hospital to hospital. Some are much more generous than others. So in Washington state, the state law is, for folks up to 100% of federal poverty, the hospital-based care should be written off. But there are hospital policies that go well beyond that and are writing off out-of-pocket costs for those up to 400% of FPL, but that really varies. There are also, federally qualified health centers and rural health clinics, but those also include sliding fee schedules. So some cost sharing is required of patients. Recently, the Washington Immigrant Solidarity Network conducted a statewide survey of over 5,700 undocumented individuals or people from mixed status households, and found that 87% of respondents lacked health insurance, and the majority cited immigration status restrictions or cost. as the key barriers to obtaining coverage. 66% of respondents identified lack of health insurance as a barrier to accessing needed healthcare services, and another 59% identified high cost of care as a barrier. And despite the FQHCs and rural health clinics availability, respondents reported inability to access healthcare services, including things just like primary and preventive care, vision, dental, and behavioral health care, among others. So, sorry, that was
Well, no,
that's how
it is a lot, but I think you just made the point that the dizzying array of complexity that a family faces when trying to determine whether or not they and their family should and can get access to health care, let alone what consequences it might have for their immigration status, is very difficult and daunting. But I'm going to ask us to step back for a moment. And obviously, each of you and the Congresswoman have been working to try to expand access to the safety net. The last administration took a different approach. And they had an argument that I'd like to ask each of you just very briefly to join with one or two key points. They argued that the access to the safety net should be restricted to those who have had been in the United States, or to those who are not likely, or that our immigration status should be restricted to those who are not likely to need to take advantage of our social safety net. Clearly, I think that there's a different point of view reflected by the advocates who are trying to help people gain access to these services. And I just wanted to ask, so we don't get lost in all of the technicalities here, sort of, can you join that question that they were arguing, that argument, and why do you think that's either the right way to go or the wrong way to go? But Huma first.
Sure. I think,
it's a hard thing to do briefly.
Yeah, sorry. Yeah, COVID has really shown, how interconnected we are as a society, and that the health and safety of each of us is really tied to that of our neighbors and community health generally, regardless of immigration status. So our essential workers, our frontline workers, are, as Representative Chu, overrepresented by immigrants, and yet they don't have access to the safety net and the supports that they need so that they can continue filling those roles. And when people are provided with the supports they need, such as nutrition, housing, healthcare, whatever it is, then the entire community and nation benefits, because people are more likely to succeed and be productive members of society. You can't really expect a child who's hungry to be able to focus in school and really meet their full potential. It's just not a realistic expectation. And as Representative Chu discussed, immigrants are overrepresented in the frontline and essential workers. And in order to, continue to maintain those vital roles in the community and keep those filled, they need the supports, just like citizen counterparts. And then one thing that we don't talk about as much, but Representative Chu did mention briefly, is also acknowledging the contributions of immigrants to maintaining and funding these social supports that then they are systemically excluded from. So there are 44.4 million immigrants in the US, and they make up 13.6% of the population. And they paid over $400 billion in taxes in 2017. But then they're excluded from the safety net. It just doesn't make sense.
Hamutal, Urban and many others in the field have been studying how immigrant families have fared over the last few years, particularly how successfully or not they have been able to access the safety net and some of the changes that came about. Can you talk a little bit about what we know?
Sure. So immigrant families' participation in major safety net programs dropped significantly and dropped more than for non-immigrant families. The administrative data, the most recent American Community Survey data, and original survey and interview data we at Urban and others have collected over the last several years, they've all built up a very strong evidence base that these chilling effects took place. Our most recent Wellbeing and Basic Needs Survey data, which we collected in December 2020, that showed 1 in 6 adults in immigrant families reported avoiding public programs or other help because of immigration concerns. And a brief we're working on now will show that it was 1 in 4 when you look just at low-income families. consistently over the 3 years we've collected this data, this avoidance was the most common in families where there were individuals without a green card. But even in families where all people born outside the US were naturalized or already had green cards, we saw these chilling effects. They were also higher in families with children. Closer to 1 in 5 adults in families with children reported those effects. The drop started in the context of discussions about the new rule, which really had several years of buildup, from leaked drafts in the public eye to the rulemaking process in 2018, and then actual implementation of the rule in February 2020, just before the COVID crisis hit here in the US. And this was an issue being covered in the media, tons of litigation, twists and turns, and widespread worries in immigrant communities across the country that participating in these kinds of programs for themselves or for their children could have immigration consequences. And there was a lot of misperceptions and confusion about what the rule said, with a couple types of spillover effects of sorts. One, to non-cash programs and resources that would not be considered in a public charge determination. The final rule specified participation in non-emergency Medicaid, food stamps, federal housing assistance would be considered in a green card application, but it didn't include programs like WIC, free or low-cost healthcare, private supports. And we do see evidence that immigrants were avoiding those types of supports as well. Another type of spillover was it affected people who would not be subject to a future public charge test. Of major concern, of course, is that children in immigrant families, most of whom are US citizens themselves. There's also the exception groups that would definitely never get a test, like refugees, where there were chilling effects. There was a misperception that public charge considerations would impact citizenship applications, not just green card applications. And so current green card holders felt those effects. And the extent of this misunderstanding was very large. In our 2019 data, we found only 1 in 5 adults in immigrant families knew that children's participation in these programs would not be considered in a public charge test. And similarly, only 1 in 5 knew that it wouldn't affect citizenship applications. So there was a lot of confusion and misperceptions about what the rule actually said. And it played out, unfortunately, in drops in participation. It also played out for service providers. And we saw a lot of that on the ground in site visits we did in Houston and in Las Vegas. And those service providers and people, healthcare providers, the enrollment assisters, all the people involved in trying to get supports to families had to contend with this quickly evolving policy and litigation outcomes. They had to follow all of that to be able to provide accurate information to their clients and work to sort of reassure families and correct those misperceptions about what the rule might mean for them. So it's been an enormous dynamic, both for families and for communities.
So I want to cover 2 things quickly before we wrap up. So Huma, many of the programs that we're talking about, there are federal rules and policies, but as you mentioned earlier, they're largely administered at the state and local level. And given both the circumstance that Hamutal just described in the past, but almost certainly continuing degrees of confusion, what do you see is the role of state and local governments in supporting immigrant communities and helping people to navigate to the programs that make best sense for them?
Yeah, state and local governments have played and continue to play, a key role in filling gaps in the safety net and addressing some of this confusion and ongoing fear in the community. So just looking at in the healthcare context, there are states that have expanded coverage to all children, regardless of immigration status, coverage for pregnant folks, access to family planning services, and then implementing COVID-specific programs that touch on some of the other determinants of health that we had discussed previously, like programs including emergency cash, rent and utility assistance, payments to families who are excluded from the federal stimulus funds. But there are still, this really varies from state to state. There's still states that haven't taken up the option to expand, Medicaid or CHIP coverage to all children, regardless of immigration status. And so there's a lot of flexibility there, but it does vary based on, the politics in each state and what's going on there. There are local programs as well, like county-based coverage programs that counties across the nation have implemented to increase access to healthcare services for low-income folks, regardless of their immigration status, and things like that. So there's a lot that can be done.
So I want to ask each of you to briefly close with just a thought about intersectionality. The country, I think, is rightly coming to understand the extent to which there is built into our society so many systems and structures that prevent access to opportunity for folks of different ethnic and racial background, among other things. And yet we're also seeing that immigrant communities, for the most case, reflect people from different racial and ethnic backgrounds as well. And so you see a layering of effects. And I'm just curious if you think about this moment and the opportunity we have to draw attention to racial and other barriers in society and to try to think about how policies could help to overcome them. How does that affect the conversation that we've just been having? And Huma, I'll start with you and then ask Hamutal to close us out. So please be brief.
Sure. So I think, improving access to the safety net and health coverage is, really tied to, systemic racism and how we are in the midst of a public health emergency, a global pandemic, and the communities that are disproportionately contracting, being hospitalized for and dying from COVID are the ones that are most likely to be uninsured or underinsured, and the ones least likely to have access to the needed supports. So it's really rethinking the safety net in general, removing some of these immigration status restrictions that exist that we discussed earlier, and really ensuring that everyone has the supports they need to be able to thrive and be productive members of society.
Thank you. Hamutal?
Yeah, I guess the main point is when you look at racial disparities in the data, say in COVID vaccine access, for example, or any range of policy issues that we care about, looking at those disparities just by race or ethnicity, it masks the immigrant part of the story. So when we see disparities for Latinx or AAPI or Black communities, for example, it can be really instructive to point out that nationally, 1/3 of Latinx people, 2/3 of AAPI people, and 1/10 of Black people were born outside the US. And many more are second generation with a parent who was born outside of the US. So that realization, that can really enhance our perspective on what that disparity really looks like, and also what policy or practice measures might be needed to make a difference and mitigate it. So I think the intersection is really important to think about.
Well, we're enormously grateful to both of you for helping us to think about those questions and more. Huma, it's wonderful to have you with us. Hamutal, as always, thank you for your great work on these questions. To all of our audience, thank you for being with us for another Evidence to Action. We look forward to seeing you soon. Be well, everyone, and be safe.